Hello and welcome. Let's memorize exam specific Brodmann's area. So, for that, we have to orient ourselves with this image, and then you can sit back, relax, listen, and learn. So, central sulcus and anything that is anterior to the central sulcus is generally concerned with motor. All of this part of the brain, motor. Okay, posterior to the central sulcus is sensation, sensory. So all of this part of the brain is going to control sensations of the contralateral side. Similarly, for motor, contralateral side. Okay. Now we start with area 1, 2, 3, which is primary somatosensory cortex, which is present in the post central gyrus. Remember, posterior to the central sulcus, sensory. So area 3 to 1, primary somatosensory cortex, post-central gyrus. Area 4 is anterior to the central sulcus, so primary motor cortex, precentral gyrus. It controls the contralateral voluntary movement of the body. Then you have 5 and 7. 5 and 7 are sensory association area, which are present in the superior parietal lobule. In the superior parietal lobule, area 5 and 7 in the superior parietal lobule. Okay, area 5 and 7 in the superior parietal lobule. Then you have 8, which is frontal eye field, and it is present in the medial frontal lobe. 8, frontal eye field in the medial frontal lobe. 17 is primary visual cortex or striate cortex. Primary visual cortex, area 17, banks of the calcarean fissure. It is, of course, for vision. Then we have area 18 and 19, which are visual association areas. 18 and 19, visual association areas. The remaining part of your occipital lobe. The remaining part of your occipital lobe. Okay. 17 is primary visual or striate area. It's in the banks of the calcarean fissure in the occipital lobe. Then we have area 28, which is primary olfactory area. Area 28, primary olfactory cortex and the limbic association cortex. So it is parahippocampal gyrus, smell and emotion. Smell and emotion. This is why they say wear a good perfume, because smell is also related to emotions. So if you want to impress someone you like, wear something pleasant, and that's going to be sensed by your area 28, primary olfactory area, which is also your limbic cortex, and it is the anterior part of the parahippocampal gyrus and uncus, and that is for your smell and emotions. Next, area 22, which is our favorite Wernicke's area. Area 22 is Wernicke's area, right? And area 22 is Wernicke or sensory speech area. So again, it is sensation. So it is posterior, and it is in the superior temporal gyrus. It is posterior to the central sulcus, area 22. Okay, and it is your sensory speech area, and it is for your superior temporal gyrus, present in the superior temporal gyrus. Next, you have 41 and 42, which is primary auditory area. 41 and 42, primary auditory area, and it is in the superior temporal gyrus, Heschel's gyrus. Superior temporal gyrus, Heschel's gyrus. Next, you have 44-45, which is Broca's area. 44-45 is the Broca's area. So that is your motor speech. It controls the movement of your mouth to generate language. 44-45, it is motor speech. Okay, it controls the movement of the mouth. Broca's area in the inferior frontal gyrus. In the inferior frontal gyrus. Next, we have area 43, which is gustatory or taste area. 43, gustatory or taste area, which is in the inferior part of the parietal lobe and posterior to the general sensory area of the mouth. So inferior part of the parietal lobe, it is gustatory or taste area, which is area 43.